Your feet communicate quietly, not in words, but through subtle signals. Often, these hints are dismissed as normal aging. After 60, aches may appear, skin may dry, and sleep may become restless. Yet some changes below your ankles are not about age. They reflect what is happening in your blood. I have spent 24 years in internal medicine, focusing the last decade on metabolic health in adults over 55. Through this work, I have seen clearly, diabetes rarely starts with a diagnosis. It begins with a whisper, frequently in the feet. Consider 9 warning signs your feet may show that are often missed by people and even some physicians. For each, there is a reason beneath the surface and an action you can take tonight. About 6 weeks ago, a 71-year-old woman named Gloria came to see me. She lived independently, gardened daily, and cooked her meals. Outwardly, she appeared well, yet she mentioned, almost casually, strange sensations in her feet. Tingling at night, cracked heels that would not heal, and a small sore on her toe present for 5 weeks. On examination, she displayed 6 of the 9 signs I describe here. Lab results showed an A1C of 8.2. She had been living with uncontrolled type 2 diabetes for nearly 3 years. The clues had been present on her feet all along. The first sign is persistent tingling or pins and needles. Sitting in a chair, watching TV, you might notice prickling in the soles or toes. A foot that simply falls asleep recovers in 30 seconds. Tingling that appears without pressure, at night, or in the morning signals nerve issues. High blood sugar damages peripheral nerves, the long nerves running from the spinal cord to the toes. Sugar molecules interfere with myelin, the insulating layer. Damaged insulation scrambles nerve signals, producing buzzing or tingling sensations. Imagine listening to a radio slightly off frequency. The music is there, but static overlays it. Approximately 60 to 70% of people with diabetes develop peripheral neuropathy. The feet are usually the first affected. A simple nightly practice is rolling each foot over a tennis ball for 2 minutes, applying gentle pressure in slow circles along the arch and heel. This stimulates nerves, improves blood flow, and heightens awareness of foot health. The second sign is burning sensations, often at night. Patients report stepping into bed feeling fine, but within an hour, the soles feel like they are on a hot surface. Kicking off covers or hanging feet over the bed does not help. This pattern suggests small fiber neuropathy, a type of nerve damage targeting thin fibers that sense temperature and pain concentrated in the soles. Damaged fibers send false signals, making the brain perceive heat where there is none. Small fiber neuropathy often appears early in prediabetes and type 2 diabetes, sometimes years before official blood sugar thresholds are crossed. To reduce nighttime burning, soak feet in room temperature water for 5 minutes before bed and avoid refined carbohydrates after 6 p.m. The third sign is a cut or sore that refuses to heal. A 69-year-old man, Robert, stepped on a small piece of gravel barefoot. The tiny puncture seemed minor, but 4 weeks later it remained open, red, swollen, and developing odor. High blood sugar hinders healing in 2 ways. Small blood vessels stiffen and narrow, limiting blood flow, while elevated glucose impairs white blood cell function. This combination slows repair, leaving wounds vulnerable to infection. Think of it as a repair crew delayed by traffic. Damage remains unresolved. A wound that remains open on a diabetic foot reflects exactly this process occurring beneath the surface. According to the World Health Organization, complications involving diabetic feet rank among the most expensive and destructive outcomes of the disease worldwide. Somewhere across the globe, a lower limb amputation related to diabetes takes place every 30 seconds. A useful habit is a weekly foot examination. On Sunday evening, remove your socks and inspect both feet carefully. Check between the toes, around the toenails, across the heels, and every visible surface. If any injury shows no clear improvement within 5 days, contact your physician's office on Monday morning rather than delaying. Another warning sign is a change in skin color around the feet and ankles. This is often the easiest clue to see, yet many people overlook it because they do not realize it has meaning. Some individuals notice darker or slightly purple skin around the ankles and assume it is simply the result of sitting too much. In part, circulation is involved. The more important question is why circulation has become impaired. When blood sugar stays elevated for months or years, it injures the endothelium, the inner surface of blood vessels. Under healthy conditions, this lining remains smooth and flexible, allowing blood to move efficiently. Excess glucose gradually makes it rougher and less elastic. Blood vessels in the lower legs already work against gravity to return blood toward the heart. Over time, that effort becomes less effective. Blood begins collecting in the lower extremities, oxygen delivery decreases, and the skin starts changing color. Imagine a garden hose exposed to years of sunlight. It loses flexibility. Cracks appear. Water leaks where it should not and no longer reaches the end with the same strength. Blood vessels experience a similar process, while high blood sugar acts like years of damaging exposure. Research published in the International Journal of Lower Extremity Wounds found that discoloration in the lower limbs appeared in more than 40% of patients when diabetes was first diagnosed. This suggests the change often develops long before testing occurs. A simple daily routine can help. Spend 3 minutes each morning performing seated leg extensions and ankle pumps. Straighten one leg, pull the foot toward the shin, hold for 5 seconds, then relax. Alternate between legs. This activates the calf muscle pump, the body's natural system for moving blood upward from the feet. It requires very little effort and no cost. Another sign involves dry, cracked heels that fail to improve despite repeated use of moisturizers. Many people apply creams for months or even years, yet the cracking continues. Some cracks become deep enough to bleed. The reason is that the underlying problem often does not begin at the skin surface. The autonomic nervous system controls functions that operate automatically, including heart rate, digestion, body temperature regulation, and skin moisture. A branch of this system manages sweat gland activity in the feet. When prolonged high blood sugar damages these nerves, sweat production decreases dramatically or stops altogether. As a result, the feet lose natural moisture from within. Skin becomes dry, thickened, and eventually splits. Think about a riverbed during a drought. The ground cracks not because water failed to arrive from above, but because the underground water supply has dropped. Rain alone cannot restore a depleted water table. In the same way, creams cannot fully solve a problem caused by nerves that no longer signal sweat glands properly. Findings published in the Journal of Foot and Ankle Research showed that autonomic dysfunction in the feet, measured through sweat output testing, exists in a substantial number of people with prediabetes. In some cases, it appears years before blood glucose reaches diagnostic levels. A recommended approach is applying a urea-based foot cream containing 10% to 25% concentration to the heels each evening. Urea attracts moisture into the skin more effectively than many standard lotions. After application, wear cotton socks. This can help manage symptoms, but lasting improvement begins with evaluating and controlling blood sugar levels. The sixth sign is ongoing swelling in the feet and ankles. Among adults older than 60, this is one of the most common complaints. Because it is so common, it is frequently dismissed. Long hours standing, hot weather, or a salty meal can certainly produce temporary swelling. The difference lies in persistence. Temporary swelling typically improves overnight. By morning, the ankles appear normal again. When swelling remains present after rest, appears in the morning, or leaves an indentation after pressing a thumb into the skin for several seconds, that is edema. Edema in the lower extremities is often associated with kidney stress, one of the earliest organ-level effects of chronically elevated blood sugar. The kidneys are highly precise filtering organs. Every day they process roughly 50 gallons of blood, removing waste products and regulating fluid balance. High glucose levels gradually damage the microscopic filtering structures known as nephrons. As more nephrons become impaired, excess fluid remains in the body rather than being eliminated. Gravity then causes that fluid to collect in the feet and ankles. Picture a bathtub with a partially blocked drain. Water continues leaving, but too slowly. If the faucet remains on, the tub gradually fills. The kidneys function like that drain, while persistent high blood sugar slowly interferes with normal flow. The National Institute of Diabetes and Digestive and Kidney Diseases reports that approximately 1 in 3 adults with diabetes develops diabetic kidney disease. Swelling in the lower extremities is often among the earliest visible signs that kidney filtration is declining. One practical step is reducing sodium intake to less than 2,000 milligrams per day. This requires checking labels on canned soups, deli meats, frozen dinners, condiments, and other packaged foods. Sodium encourages fluid retention, making edema more severe. When resting, elevate the feet on a pillow so they sit above heart level. Even 15 minutes can produce a measurable improvement in fluid movement throughout the body. The seventh sign is sharp, stabbing pain in the feet that does not respond well to common pain relievers. Another important signal is sharp, stabbing pain in the feet that common pain medications fail to relieve. This symptom creates considerable confusion and often leads to prolonged discomfort because many people spend months, sometimes years, addressing the wrong condition. They seek medical advice for foot pain and are frequently told the cause may be plantar fasciitis, arthritis, or perhaps a bone spur. Insoles are prescribed. Anti-inflammatory medications are tried. Some individuals even receive cortisone injections. Yet the discomfort continues. The pain often returns during the night. It can be sudden, intense, and may feel like an electrical shock shooting through the arch or ball of the foot. The underlying process is not silent nerve deterioration. Damaged nerves become excessively active. After prolonged exposure to elevated blood sugar, certain nerve fibers enter a hyperexcitable state and begin firing without any external stimulus. The brain receives emergency pain messages and reacts as though a serious injury has occurred, even while the person is resting in bed. Imagine a smoke alarm with a failing battery. Rather than becoming silent, it emits random warning sounds at 3 a.m. There is no fire. The device is malfunctioning. Injured nerves behave in much the same way, generating alarm signals when no actual threat exists. For that reason, medications such as ibuprofen cannot correct a nerve firing improperly at the cellular level. Research published in Pain Medicine reported that painful diabetic neuropathy is frequently mistaken for a musculoskeletal disorder during early evaluations. This often results in a diagnostic delay exceeding 2 years. For individuals whose foot pain does not improve with standard over-the-counter pain relievers, discussion with a physician about neuropathic pain is important. Treatment approaches differ. Medications differ as well. Most importantly, blood sugar management remains central to addressing the source of the problem. With physician approval, a nightly magnesium glycinate supplement may support nerve function and help reduce the severity of nerve-related discomfort. Another warning sign involves feet that remain cold. Nearly every patient older than 65 mentions cold feet at some point. Usually, this is not concerning. Occasionally, however, the description stands out. Some individuals report cold feet during the middle of summer. Others describe feet that remain cold under an electric blanket, while the rest of the body feels comfortable and warm. That contrast draws attention. Persistent, unexplained coldness is a classic feature of peripheral arterial disease. In this condition, arteries supplying the lower extremities become significantly narrowed. One major contributor to that narrowing is chronically elevated blood sugar. Over time, excess glucose accelerates atherosclerosis, the accumulation of plaque inside arterial walls. The arteries supplying the feet are among the smallest and farthest from the heart, making them especially susceptible. As these vessels narrow, warm blood reaches the feet less effectively. Tissue temperature declines. The sensation of coldness reflects a genuine reduction in blood flow. Think of a house heated by radiators. The units nearest the boiler warm quickly and remain hottest. The radiator located at the far end, connected through the longest stretch of piping, receives less heat. The feet resemble that distant radiator, while plaque buildup gradually narrows the pipes. The American Diabetes Association reports that peripheral arterial disease occurs 2 to 4 times more often among people with diabetes than within the general population. Cold feet are consistently recognized among the earliest symptoms. One of the most effective non-pharmaceutical strategies is a brisk daily walk lasting 20 to 30 minutes. Walking forces blood into the lower extremities, encourages the development of new small blood vessels known as collaterals, and can improve circulation over time. If 20 minutes feels difficult, begin with 10. If necessary, start with 5. The important step is beginning. The 9th warning sign is loss of hair on the feet and lower legs. This indicator often goes unnoticed because few people actively check for it. During examination of the lower legs, attention is paid to hair distribution. Hair growth on the upper leg is compared with growth on the shin, ankle, and top of the foot. When circulation is healthy, hair tends to grow relatively evenly. If blood flow to the lower extremities has been impaired for a long period, hair follicles receive less oxygen and fewer nutrients. Gradually, they become inactive. The result is often a clear dividing line. Hair remains present higher on the leg, while below the midcalf the skin appears smoother, shinier, and largely hairless. This serves as a remarkably dependable visual sign that blood vessel damage has been developing quietly, often over many years. Consider grass growing on a hillside. Near the water source at the top, growth is thick and healthy. Lower down, where irrigation no longer reaches effectively, the ground becomes bare. Water still exists, but it no longer arrives where it is needed. Blood serves the same role in the body, and the feet occupy the farthest point in the system. A comprehensive review published in Diabetes and Vascular Disease Research confirmed that hair loss on the lower extremities is a clinically meaningful marker of peripheral vascular insufficiency and is strongly associated with long-term glycemic dysfunction. A simple self-check can be performed after a shower. Sit on the edge of the bed and examine the lower legs and feet. Compare hair growth in these areas with the rest of the leg. If there is a dramatic reduction or complete absence of hair below the knee, arrange a fasting blood glucose test during the week. The test is quick, affordable, and commonly covered by insurance plans. These 9 signs represent 9 messages the feet may have been sending for months or even years. Most are not dramatic. They rarely create an emergency. They develop slowly and quietly. That gradual progression is exactly what makes them easy to overlook. By the time symptoms become impossible to ignore, damage may already be well established. Yet there is an encouraging reality. Early detection can significantly alter outcomes. In its initial stages, diabetes often responds well to straightforward lifestyle measures: improved nutrition, regular walking, proper hydration, consistent sleep. These are not extreme interventions. They are practical decisions that can begin immediately. Take a moment to pay attention to your feet. Observe them carefully. Notice changes in sensation, appearance, temperature, or healing. If any of the signs described here seem familiar, arrange a blood glucose test without delay. Health, independence, daily routines, and the people who rely on you all deserve protection. A simple blood test can identify a problem early, and sensible habits can help manage it effectively. CTA. If this information was valuable, share it with family members and friends who may benefit from it. Leave a comment with your thoughts and experiences, and stay connected for more in-depth health discussion. Please leave your thoughts about this content in the comments below. Thanks for watching. See you in the next one.